Hello and welcome everybody. Today is May 28th and you guys are all here for our question and answer period with Dr. Jaime Lee and myself, Samantha Upshall. Today, some of our pre-submitted questions that we're going to go over. So some folks have already submitted questions versus asking live. First one is, why am I not losing weight even though I'm eating healthy and exercising? We hear this one an awful lot. I also have, what weight loss medication is best for me? And will I gain it back when I stop it? We'll definitely be covering that one. This one is also another common one we hear in our clinic. And I've hit a plateau. What do I do now? I only ever lose 10 pounds, then it all comes back. Not sure if any of those questions that we have here sound familiar to you guys. It is not a personal problem. This is an obesity problem, and this is what we're here to help and talk to you guys about today, about some of your best management, helping keeping you educated and coming from educated backgrounds here. So I'm just going to stop sharing this screen and we'll come over and we'll say hi to Dr. Lee. How you doing?
I'm good. How are you guys?
Now, not many of you folks have the opportunity to sit down with Dr. Lee, and that's why these sessions are wonderful for you guys to be able to connect and ask your questions to the physician. You guys have the opportunity to sit down with myself as a nurse and Felice was our health coach, but we're going to hear from Dr. Lee today. So where we're at today, I'm just wondering with the attendees that we have on board, if you're able to give us a wave hi from down here in one of your buttons, just to let us know you're there. If there's any questions along the way, I got a hi, thank you. Any questions along the way, please just go to the chat session area and just type down and we'll catch it once we're finished one of our questions that we're going over there, and we'll answer yours right live here today. And once again, thank you for joining us. So here we go, Dr. Lee, the very first one, very common. Why am I not losing weight even though I'm eating healthy and exercising? And there's quite a few points that we could actually talk about today. We can go everywhere from it's a science, not just a willpower. So talking about metabolic adaptations. We can even talk about checking in on ourselves with the underestimating or overestimating of intake that we're doing and any hidden disruptors. So those hidden disruptors, things may seem normal, but hey, stress may pop up, sleep may be different. There could be different activities or holidays. So May,
Mm.
we've had May 2 for, um, you know, different long weekend and different needs and purposes, maybe for celebration. We've had Mother's Day for all those mothers out there, having food as the biggest giver that we hand across. But I'm going to
Hmm.
get Dr. Lee to talk a little bit about some of the things that you guys can think about. And maybe I'll talk a little bit about reframing some of these thoughts as well.
Hmm.
So, what do you have to say to that when someone walks in the clinic, Dr. Lee, and
Yeah,
says, I'm not losing weight, and I'm eating
yeah,
healthy, and I'm exercising?
yeah. That's definitely a statement that people say a lot in our clinic, and obviously it's one of the reasons why actually people come to our clinics too as well, right? Because they have this problem. But you know, just look at the question itself. It only takes into account two things for weight loss or weight management: food and exercise. And a lot of times that's all we think about, right? Food and exercise as the key factors. And so New Year's resolution, what do you do? I'm gonna go join the gym, which is exercise. You know, I'm gonna buy a new pair of shoes or whatever, or I'll start eating cleaner. I'll stop, reducing my alcohol intake or eating out less. So when we deal with obesity, there are so many factors that affect weight management. And so we look at the social environmental component, we look at the behavioral component, and there's also the biological component too as well. And obviously your biology to a good degree you can't change. And so but the influences into our biology are massive, right? And from the very beginning, as we were young, we are conditioned to behave a certain way. We are conditioned to react a certain way. As you mentioned, food is integral to all our celebration, but also, in our setbacks as well. We eat it emotionally to make us feel better, right? There's a component of that. So when I hear that, I like to clarify for the patient that one, weight management is not just about food and exercise. Don't get me wrong; it is an important part of it, and we do this a lot. But if that's all we do, we don't need a full year to help the individual change for the rest of their lives, right? So I'm going to start just talking about, some of the factors that affect weight management. And it's something that we do in our office, or at least, part of my subspecialty. I'm also a sleep specialist. And so, you know, your sleep in general is so important to weight management. It really sets the tone for everything. And so, without sleep, you can't function well, you can't think well, you can't make the right decisions, you have higher hunger hormones. We tend to gravitate to food that are higher in quick energy. So these are more refined food products to boost our energy. And then when you have a more refined food product, what happens? You crash more, and it's a vicious circle. You feel lethargic, and then you go gravitate to that, and then it's a learned behavior over time to as well, right? So if you have any concerns or issues with respect to being tired in the morning, tired throughout the day, someone says you're snoring, you should definitely get your sleep assessed. It's so easy to do that. We know more and more now that sleep disorder breathing affects pretty much all aspects of the system, from cardiovascular, mental health, insulin resistance, metabolic syndrome, blood pressure control, all that too as well. So really, when I talk about sleep in general, in terms of weight management, it has a lot of behavioral influences too as well, right? It sets us up for the day. So your day doesn't start in the morning. Your day really starts the night before, right? And so usually what we try to do here is get people kind of fixed with respect to the sleep, to help with that. And people don't realize that sleep, there is an inflammatory process that goes on with sleep, right? There's a low grade inflammation that goes on. And so that actually increases the stress. We know that stress plays a big role with weight management, so chronic stress. And honestly, Sam, we actually don't realize some of the chronic stress that is on us on a regular basis, right? Until things really break down, or we have a vacation, and we see the differences in terms of our day-to-day life cycle. And we know that then, as leading to this, stress plays a major role in inflammation, right? So we know, like, chronic stress, the low grade release of cortisol changes our adiposity, meaning that, hey, how we handle um, the energy that comes into our body, where fat is distributed to as well. You tend to have more visceral fat, more central abdominal fat when you have more stress and cortisol too as well. And so that plays a role. So handling stress plays a big part too, as well. When it comes to nutrition, you know um, recall bias is one of the biggest thing that we see. Honestly, I can't think of the food I ate last week. Sometimes I forget, like 2 days ago. And so our mind, the way it works, is really, really good at protecting us as an individual. It protects our ego. And so a lot of times we don't think of the negative things that we do, or the negative behaviors that we do. We only tend to think of the positive way. We tend to see ourselves, for the most individuals who don't have any mental health problems, see ourselves in a positive light. And so because of that, we're biased. We're biased into food recall, right? And studies have shown that food recall bias is real, and everybody does it, right? And the other thing, though, too, as well, is the nutrition part. The estimation of calories in of itself is poor too as well, right? And we tend to underestimate about 20, even up to 30% of the food that we eat, the amount of energy we eat. And a lot of times we probably forget what we eat, the little snacks that goes along. So what that points them
Autopilot kind of moment, right?
Yeah. We just think of the major meals and we forget the little coffee, the Starbucks, when you grab a piece of fruit or chocolate bars and a cookie. We tend to forget these little minor foods that add up, right? So for example, if you ate, I don't know, a cookie, a small one, that's probably 80 to 100 calories. You're going to be walking for about 30 minutes to burn that off, right? And from an energy balance perspective too as well. So the thing becomes tracking and consistency of your food. So, right, so those two things become very important. And so one of the things that we do for our patients, that this kind of alludes to, one of the questions was that, well, I'm not losing weight. What do I do? Well, we start to scrutinize the behaviors in the food. We start to track it precisely to see where the flaws are, where the recall biases are, right? And so that's kind of what happens. So let's
In
say if
that
someone,
in that
yeah,
situation, I would say get curious, not critical.
that's right. We have to really look at our journey as learning. If weight management was easy, you know, everybody would have been successful. It is so difficult. Actually, I was on a podcast this morning with some orthopedic surgeons just talking about weight management, GLP-1s, and they wanted me to talk about GLP-1s. I took them through a bit of a history with respect to weight management. We talk about Jenny Craig, Weight Watchers, Bernstein's, all these kind of brick and mortar stores, big players. They are actually shutting down all their stores, brick and mortar stores, because of the shift in the management of obesity. It is a medical problem. It's a medical condition, obesity, and it has lots of psychosocial behavioral component. I used to give a talk to the bariatric program in Guelph, and I had this slide of how obesity is affected, and it's basically arrows everywhere and different aspects of our lives that are affected. So to say that just nutrition and exercise are the two main things, I think we have to change the optics a little bit with respect to that and be realistic with ourselves that it involves a lot more. That's why it is so difficult to manage. You need people with expertise in certain areas to tease that apart. So that's one. The exercise part too as well. I mean, I'm going to touch upon that. A lot of times, what happens when we start to exercise, which is obviously a very good thing, is that, well, when you burn calories, the body is smart. It needs calorie back. And so a lot of times what we do is that we increase our food consumption or energy consumption without realizing. We eat a little more, or we change our eating habits. We eat more protein, right? And when you eat more protein, sometimes it's a little more calories as well, because we have the fat, which is 9 calories per gram, versus protein, carbohydrates are 4 calories per gram. So we're talking about 2.5 times as much calories. And so what happens is that we tend to eat more calories. And the other thing is that when people start their journey with nutrition and exercise, they tend to go all out right away. They tend to, really exercise really hard, 80, 90% of the maximum heart rate for an hour or 30 minutes. Well, you're going to be ravenous in terms of food. And so you're going to eat a lot more. And a simple behavioral response is we tend to eat a lot faster, a lot more when we're hungry. And so, there is a delay in the brain of about 20 minutes to say that we're actually satisfied. It's actually we're full. And by that time, you've already eat usually about 20, 30% more calories than you really need. And so one of the things we teach, in our clinics is to slow the eating down, so to get that cue of satisfaction in terms of satiety rather than being full per se. And so that happens. So, when you start exercising, you tend to be a little more hungry, you tend to eat a little more. The last thing, the body is starting to adapt, i.e., you're eating more, you're exercising more, your body's going to build more muscle. And so then you balance out a little bit sometimes, right? So you might start losing a bit of fat. Obviously, it takes a bit of time to lose fat. One pound of fat is about 3,500 calories. And so if you look at your calorie deficit of 500 calories per day as a net calorie loss of energy loss, then Sam, you're looking at about 1 pound per day. So, 7 times 5 is 35, 35. So 3,500. So you look at 1 pound per, that's just pure fat loss, right? And so then you get a bit of balancing of your weight, So looking at your overall marker of success as just the pounds on your scale is not, that does not tell you the entire story of what's happening in your body as you're changing nutrition, as you're increasing your exercise. And we know that muscle mass is more dense, so you got a bit of a balance for that. Some people gain weight when they start to eat a little better and exercise, and that's because of the increase in body mass that's happening, the skeletal muscle mass. And that we catch this a lot because people are like, well, they lost 1 pound, and we do their scan when they come see us. Well, what happens is that they've lost 3 pounds of fat but gained 2 pounds of muscle mass. Well, that's the actually ideal way to lose weight, to maintain or increase your muscle mass, which increases what? Your basic metabolic rate, and then to lose fat, right? Which reduces inflammation, reduces the insulin resistance, etc. All the inflammatory cytokines too as well. And so, the bottom line is that, when people say it's just, I eat well, and I exercise or change the way I eat and exercise, I'm losing weight. Well, the bottom line is those two factors are not the only factors that affect weight. There is a whole slew of factors that I just mentioned too as well. And so we really have to look at all the factors, even looking at the quality of food matters as well. For example, I'll tell you, if you talk about grain-fed beef versus grass-fed beef, if you actually look at the colors of the fat, there's a bit of a difference between the colors of the fat too as well, right? And you look at kind of the amount of triglycerides and the saturation of fat, there's a difference too as well, actually. And so grain-fed tends to be more, have a different hue, a little more yellow type of fat versus grass-fed too as well. And so your quality of food really, really matters on top of that. So, I mean, we scrutinize more quality food as people progress in the weight loss journey, because you're trying to eke out more success. You have to put in a little more effort for that.
I'm wondering, I want to just spend a few more moments on this topic here in this question, because I want you to chat a little bit about the resting energy expenditure as well, and the possibility of individuals that may have, this person may have already lost weight 6 months ago, had a significant weight loss, and wants to continue on.
Yeah. So when it comes to weight management, I mean, the body doesn't like a lot of change. Homeostasis is what we call, it likes like an even keeled state, right? And so, a lot of patients who come to us have attempted, successful weight loss in the past. I mean, if you've lost weight, you attempted weight loss and you lost 20 pounds, you are successful. What you're not successful is in maintaining your weight. And so what happens, let's say, Sam, if you have done this 4 times in your life before you come see us, well, what happens each time? Well, one is you're older, right? So your basal metabolic rate starts to drop up to the age of 30, right? So 1% per year. And that correlates with 1% decrease in body mass, a skeletal body mass, okay? Lean body mass per year as well. That decline tends to be a little more rapid as you get post-menopause or post-andropause as well. So your testosterone decreases, growth hormone decreases, all these things that keep us nice and youthful. So that's change. That's why it's hard to lose weight too as well. So I'll take you to the very first time you lose weight then, Sam. What happens is, depending on your age, is that there is a physiological adaptation to weight loss. So it depends on the rapidity of your weight loss, meaning that how fast you lost weight, how significant your calorie deficit was. So if your calorie deficit, just say you're average male, you would eat between 800 to 2,200, 2,100 calories. That's usually the average male. And so let's say you cut your calories down to 1,200 calories. Well, that's a huge shock to your system. And the body is really good at survival. Okay. And that survival mechanism will kick in. That famine mechanism will kick in. That's an evolutionary process. So what does it do? One, well, there's a physiological change to your metabolism that happens. Your body will start to reduce its metabolic rate to slow the weight loss down. This is why our weight loss starts to slow down after 2 to 3 months, right? It's a physiological adaptation that goes on. Even if you eat the exact same amount of food, you burn a similar amount of calories. And we learned this actually from The Biggest Loser. I don't know if you remember 8 years ago, whatever, The Biggest Loser comes out. There were studies. It's very, very, very interesting study, Sam. I mean, I feel bad for these individuals, but they would lose 120, 140 pounds in whatever season it was. And you're talking about 3 to 4 months, right? And they're dropping that weight. So what they did was actually they tested the efficiency of muscle contraction for these individuals. And so what I mean by that is that how much energy is required for them to, let's say do a bicep curl before and after they had a massive weight loss. So what they discovered was that they required less energy for the same action. Right? So there's a basal metabolic adaptation. Okay. When you lose weight also, Sam, what happens? You see this, you tend to lose muscle mass as well. Yeah. And so the proportion of your fat percentage is typically the exact same as when you started. Now you had less muscle mass, less fat, total fat amount. So let's say you started with 30 pounds of fat in general. Well, you lose 20 pounds, that's less, but it's proportional to your weight, that stays the same. So what that means is that means your muscle mass has to come down too. So that happens. So when you lose weight, you tend to lose a bit of muscle mass, and depends on how you lose weight. That's very, very important. It becomes more important as you get older and older and older, and the reason for that is it has less muscle mass too as well. What happens? The other thing happened is that your metabolism, is controlled by the hypothalamus. That's your control center, and so it will tell the hormones. So there's a few hormones that affect our energy metabolism. The two main ones is ghrelin and leptin, and in conjunction with these and other secondary hormones, it tends to slow our metabolism down too as well, right? And so what happens? Well, after you start to lose the weight, or you change the way you eat, you have this calorie deficit, your ghrelin hormone, which is the hormone that makes you hungry, want to eat. So let's say you had a meal and it's you tend to eat a meal 5 hours later, the ghrelin starts to rise as you approach the second meal, right? So same thing, if you started losing a ton of weight, your ghrelin hormone starts to rise to make you more hungry, and your leptin hormone starts to decrease. That makes us feel full. But at the same time, these hormones also affect your metabolism, right? Other things that change insulin resistance, insulin growth like factors. There's other hormones that also affect your metabolism that starts to change too as well. So you've done this, let's say 4 times in your life, okay? And the first time you'll get away with it. Second time you might get away with it. Third time it gets a little harder. Fourth time it's like, oh my God, it's never the same. I used to lose weight so easily, but it's so difficult now. So this is the yo-yo part in yo-yo dieting. It's actually a natural physiological response to the stress of calorie deficit or energy deficit. And it's an adaptation that the body does for survival. And so it's not really Jenny Craig's fault or Weight Watchers' fault in that, they were successful in helping you lose weight by controlling your calories per se. That's usually the point system. It's just a calorie system, but the food choices are horrible. There's not enough behavioral change component, not enough cognitive restructuring that goes on to facilitate long-lasting changes. That's why they're not successful. And the medications that we use help facilitate this a lot easier. And this is why, they've unfortunately have gone out of business essentially. And the shift in paradigm of management is more medical because we understand the medical part of obesity more and more now than ever before.
So I think a lot of that reframing, why am I not losing weight even if I'm not eating and exercising? I think it's important that if I believe I'm doing everything right, but my results aren't changing, what assumptions may I need to challenge? And that's the big thing is always doing that reassessment and refocusing, but understanding that you're not just a willpower moment. There is the science to look into it as well, but there is all the pieces that need to go together. One alone is wonderful, but you do get the multiple benefits when you do focus on the sleep, when you do focus on the stress, when you focus on the food, on the exercise, all those in combination there. Now, our next question here coming in, I think we've covered a little bit that kind of falls into what we'll talk about
Mm-hmm.
this as well, because I've hit a plateau. What do I do now? I only ever lose 10 pounds, and then it all comes back again. Now, some of these moments we did discuss a little bit about the pathway of the weight loss there and how the body adapts. There's also a big mental piece that I feel that falls into this piece more than the beginning. I never lose weight. That's a mental piece as well, along with the physical and the changes. But plateaus are normal. They're not a failure. Just want to put that out there. They're very,
Yeah.
very normal. And
Mm-hmm.
I think it's as you said, it's the programming of our survival system. We wouldn't be alive today if we
Mm-hmm.
didn't have these systems in place, but it's biologically normal. Okay, I just want to let everyone know, let's take
Mm-hmm.
a moment to breath and pause with it, but doesn't mean that it's okay for you in this zone. You still want to go. You
Mm-hmm.
still want to lose weight. So I think it's very important that we chat about this to allow individuals to overcome that mindset, but
Yeah.
also to continue that weight loss and the things that they need to
Yeah.
focus on. So, there's going to be change of inputs that we'll have to put in there. If what we're doing isn't working, maybe we need to try a different route.
Yeah.
Maybe we need to look at things a little bit differently. Does it mean you have to turn your whole world upside down? No.
Mm-hmm.
Um, but we have to look at what's sustainable, what's not actually working long
Mm-hmm.
term. But I think we still need to keep an eye on those long-term goals,
Mm-hmm.
still go in the
Mm-hmm.
continuity
Yeah.
of what we're doing. But this one, I think, is one of the biggest
Yeah. I
social
want to
questions
just,
people have. Like,
yeah, I want people to understand the natural process of weight management, and if you see enough patients, and you see enough patients who lose certain weight, you can kind of have a gestalt of like you said, the plateaus, the natural plateaus that occur throughout the week, where people, whether you use, just kind of, no medication, throughout this. And so I'm just going to give a general description of the natural plateaus that occur. Typical plateaus occur in the first 15 to 20, 30 pounds. We see that range, and it's usually between the second and third month, you'll see the first plateau. Um, you know, you do a new routine, you have to change some things. Your input has to change to get a different output, right? And so people will start, let's say, they change the food or nutrition first, they change a little bit of this, they eat out less, all these type of things, they might sleep a little better, so it gets to a certain point. And then what we typically see is once they maintain the plateau, sorry, for about 1 month, maybe 2 months, right between there, they sometimes, if they don't do anything, sometimes will just start to drop again a little bit more. But often they start to scrutinize their behavior. Oh, we tend to scrutinize kind of the day-to-day stuff, the food stuff, track the food a little bit, and they start again once again starts to go. And the next plateau is about the 40-50 pound mark that we see too as well. We see a lot of 100-pound weight loss in our clinic. We see that. So the next time is around the 50 pound mark. And then, the next plateau I typically see is about an 80 pound, which is very substantial. You're reaching beyond, or sorry, you're reaching, bariatric level weight loss too is there as well, right? So we see another weight loss. but here's the thing. Your weight loss journey through all these major episodes, so most people go to between 3 to 4 plateaus, to be honest with you, has to change. Your eating habits, your choices has to be different in the beginning than it is in the middle and the end as well. Your level activity has to change as well. So if you're doing the exact same things, you're going to have to expect the exact same results. Your input, if it's going to be the same, then your output is going to be the same. And so think, as you said, Sam, what are we inputting that maybe, what we should be inputting that may be different to have a different output, changing the foods up, changing our fasting, changing our sleep habits, changing our exercise. And it doesn't take a lot to make a small change, a small outcome. It's a lot of accumulation when we talk about that, right? So small change over months and months and years can lead to massive changes, right? So the natural process of weight loss is, as Sam said, we do go through plateaus. Usually is 3 to 4 plateaus in a fairly, if you're losing about 80, 100 pounds, you go through 3 to 4 plateaus too as well. And really, you have to start to think about the amount of food, the quality of food, the exercise component. All these things have to be adjusted to get what you really want. And how you break through a plateau, think of it as a challenge to yourself, to your discipline, to your consistency, of and how much effort, your performance you put in. And so as you start to elevate your status, well, if you've lost 20, 30 pounds, you've raised your standard to a degree. You want to lose another 20, 30 pounds, you have to raise your standard to another degree. And so as an athlete in general, you look at those are the pinnacles, a musician, a superstar musician, a NBA superstar, they have to be the best at what they do in order to stand out of the crowd. You have to move beyond your current standard so that you can reach the next level. And that is the mindset that we should adopt.
Yeah, it's not personal, it's a process. Focus on the process, not the outcome itself. But we do take this very personal itself. And I think we do need to check in just to make sure that we are focusing in the right place. But a lot of these are
Yeah.
defeating thoughts that kind of get us and make us stop, right? That's where you got to 10 pounds. You
Yeah.
can lose weight.
Yeah. I just want to say one thing, it's important to understand when it comes to plateaus and hormones and stuff like that. The body does equal equilibrate with respect to its hormones over time. It's actually a fairly long process. You're talking about 2 to 3 years for the body to get used to your new weight. So if you maintain your weight for a few years, the likelihood you maintaining that 10 years down the road is much lot better. But you have to do it for 3 to 4 years, 3 years up, right? So that's kind of what it is.
And I think we have to be very careful with the messaging we tell ourselves. If you keep on telling yourself you fail at plateaus and you can't get beyond that, you won't get beyond that.
Mm-hmm.
It'll be very hard to, and I think it's a lot of being in the right zone mentally as well, and reframing some of the thoughts that we've had that we can go through. And it's one of the biggest processes that we work on here. You guys can open up books and figure out how to lose weight. Women's Day magazines right in the checkout everywhere we go. Do we trust them all the time? Well, no, they're not that healthy. They're quick and available, but you've got it at your resource. The reason why and how we apply it is what we need to work on as we go. So they did intertwine in together, those two questions. And our last question we have here: what weight loss medication is best for me? And will I gain it all back when I stop? And I think this is one of the biggest anti-obesity
Yeah.
medication questions. And it's very hard to say, is it best for me? Because
Mm-hmm.
there's many things that we do look at. We don't just hand out Ozempic or Wegovy or Mounjaro around here. We do
Mm-hmm.
have to look at things like your medical history, looking at your BMI and your comorbidities, your appetite patterns, your emotional eating, maybe insulin sensitivity. There's more to it. There's no necessarily one size fits all. And we sit here and we analyze that and go through, but there's many different options when it comes to, well, many, I'd love to say many. There's quite a few good options that we have for weight management. And I'm wondering if we can actually just speak to the drugs today a little bit,
Sure.
the GLP-1s,
Yeah. Yeah.
talking
That
about Crave.
makes sense. Yeah. So I think, just a quick history on these medications, previously when the drugs we use, something like for Zeneca or Orlistat, they're medications that block absorption. So Orlistat or Zeneca blocks absorption of fat. As you can imagine, what the side effects are, so the fat soluble vitamins becomes an issue. And then you get gross term, but this was the medical term, anal leakage, right? Because you don't block, because you block the fat. Obviously the stool becomes more greasy, and people have a bit of fecal incontinence because of related to that. So the first generation drugs, were those, and you can see expect a 5% weight loss. It's still available. It's still part of it, obviously, because the efficacy is so poor, we don't even talk about it, right? And then you start to get the symptomatic drugs. These are phentermines and stuff like that, and they reverse systems. Before, some people would use stimulants, and some people use thyroid to try that. Obviously totally wrong, right? Some of them led to a lot of cardiovascular complications too as well. Now we use it in a lower dose with combination of a few other things. In Canada, it's a little different from the States. And the States have a few more medications than us. They have, I believe, two more than us. But for us, we typically have the Orlistat, Zeneca, and then what happens is we shifted the paradigm to more hormonal. Which obesity is predominantly a hormonal problem. It's the endocrine system problem, right? And so these analogs that we have, we call the GLP-1s, right? And so these glucagon-like proteins, we actually have it in our system. It's called endogenous, right? And so we create analogs of this. We give the system a little more, so it's secreted in our small gut predominantly. And we have these receptors for these hormones everywhere: the brain, the muscles, the heart, the kidneys, the liver, and so it's being used not just in the obesity world. As a matter of fact, when the GLP-1s first came out, Sam, it was treated for diabetes. What did they see? Appetite suppressants, early satiety, behavioral change. Boom, big weight loss. Wow. Not only did it help with diabetes, and so how does it help with diabetes? Well, one of the things is it helps it helps with the insulin sensitization, but also it helps gastric emptying into the stomach, right? So the food gets stayed in the stomach a little longer. You feel a little more full, and it helps reduce the food going to the small intestine, where the majority of the processing of the food and absorption of food takes place. And so these individuals, their blood sugar gets better. So as a side effect of that, what happens is that then we see the side effects of weight loss, and then obviously the application of that changes, right? And so that's in the form of Victoza/Saxenda. That's basically the first GLP-1 that came to the market about 18 to 20 years ago. I remember that because I was a resident. So and then we have refinement of these medications to once weekly, which is more effective. Now we have combinations, and then we're starting to look at down the pipeline, Samantha, is other molecules like amylin, CCK, all these other ones in combinations, too as well, to help for the weight loss, even more effective. And so we have the GLP-1s, and so the most common one, Ozempic, that's the diabetes name, but the weight loss name is called Wegovy, both in Canada and the States and the world. And so that's what we're using nowadays. So that's on label. So when Ozempic came out, we used to use it off label all the time, in our clinics. And so and finally, just this past last year, it became on label. And then we have Zepbound, which is Mounjaro, which is a GLP-1 and GIP agonist, so combination of two medications. And it's even more effective too as well, right? And so you can look at the amount of weight loss in the studies, about 15 to 16% with the GLP-1 Ozempic / Wegovy, and about 21% rounded up with the Mounjaro's Zepbound medication. Now that's maximum dose. for the studies, right? And then we have an oral form. So we have another one called Contrave, and it's a combination of two medications called naltrexone and Wellbutrin. Wellbutrin is used a lot in the psychiatric world, mental health world. It's a mood stabilizer. It's an atypical mood stabilizer, and it's nice. It works in central nervous system, but we also use it in the addiction world. So we use it in the form of for smoking cessation, Zyban, right? That's the form, right? And so it has its role. It works in, again, in the hypothalamus too as well. And naltrexone, right, which is the opioid receptor antagonist and stuff like that. And so it blocks that, and it, again, works in the central nervous system to help with satiety and craving. And so there are niches to this. So we do know that Contrave is an oral medication, right? It's taken twice a day. And so sometimes we reserve these medications for someone who has a bit of anxiety, bit of mood disorder, someone who has more of addiction component, someone who maybe is smoking, someone who's, have a bit of alcohol dependence or a bit of abuse. We use it more there too as well.
Reward related eating.
Yes, someone who has a very strong craving, we use that too as well. And the other thing is that we also use it in combination too as well, right? And so in expertise, and that's where our expertise come in, is that we use sometimes medications in combination to help alleviate. And so everybody's ability or perception of satiety, hunger, and craving is totally different, right? And so, like you said, Samantha, not everybody will do well on Ozempic. As a matter of fact, the failure rate of Ozempic is about 15 to 20%.
Now, when you say failure, are we talking about side effects? Or are we talking about
You got it.
inability to lose weight?
Yeah, so can't use it, or it just does not work.
Yeah.
They don't have effective, and they might lose a few pounds, 5 pounds, 10 pounds, but pales into comparison to the studies too as well. And so the way we use the medication is super important too as well, right? And so, side effect profiles for GLP-1s typically are GI side effects. So nausea, vomiting, indigestion, reflux disease. There are other things you want to consider, as well, is pancreatitis. There's a theoretical risk of pancreatitis, but the risk in the studies are the same as general population. As a matter of fact, if you lose weight, you have higher risk of pancreatitis.
So it's the weight loss, not the med.
You have increase of cholesterol stones, i.e. gallstones, which increases the risk of cholelithiasis, which can increase pancreatitis. So it's the hydroglycerides and stuff like that, the cholesterol that gets broken down by the fat that increases. People don't realize how if I want to say dangerous, I don't want to scare people, but the physiological chemical changes occurs in the body, electrolyte imbalances, sugar imbalances,
cholesterol shift.
So all these things actually occur during that. We just, our body has a big buffer, so it can handle it. So the more rapid the weight loss, the more you're having problems with this. The slower the weight loss, the body can adapt and process all these changes too as well, right? And so the amount of education on how to use the medication plays a big role. I typically don't like to use maximum dose, because we use it differently. We don't just titrate up based on the algorithm protocols of the studies and stuff like that. For example, 2.4 milligram is the maximum dose for Wegovy. We typically stay below 1 milligram. I say probably almost half of our patients are on 0.5 milligrams. We work on the component, the mental component, the cognitive component a lot to help stay a low dose. And to answer the second part of the question is, well, how long should I stay this? Do we get weight regain when I come off the medication? Well, what happens when you change your behavior back to your old behaviors? You regain your weight, right? So naturally as well, if you come off the medication, you've taken your foot off the gas pedal for a mechanism that reduces hunger, satiety, and craving. And the studies have shown this very, very well. Actually, it's one of the step trials for the Ozempic. They've done a 5-year study with this. That's why these medications are very safe in that respect. And so all these TikTok stuff about those things. It's hard for me to swallow those information. But having said that, what happened was they did the study. People were on it for I believe like 6 months or close to a year maybe. And then they split the groups up. Well, half the group will stay in the medication, half the group will come off the medication, and boom, within a year, the people came off the medication, regained the majority of their weight or all their weight, and the people who stayed on the medication, there was only around 5% weight regain. 5 years, little 10% or more about 5 years down the road, and so you can see that these individuals, keep their weight down better with the medication. Now, is it the medication's fault? You can blame the medication, but I like to think that it's more of a physiological response to what's happening, and the weight regain can be very fast too as well. If if you're have adapted to a massive weight loss, let's say about like 50-60 pounds, and your metabolism has changed and adapted, well, if you go back to the same calories that you're eating, you're going to gain it within months. And we hear this all the time. I lost this. I took me 2 years or a year to lose this weight, 2 years to lose this weight, and I gained it back in like 6 months or 8 months. And that's the physiological adaptation part. And so there's a lot of physiology with obesity. And so the answer is, weight management is a lifelong problem if you've had this problem, for a long time. If you have significant weight to lose, it's something we have to accept, that we have to work on to a degree for the rest of our lives. Just like, we take medication for hypertension, high blood pressure, we take medication for diabetes and stuff like that. If you don't do anything about it, you will continue to take the medication. You will continue to use the CPAP if you don't lose weight too as well, right? So it becomes, how much medication do you need to maintain your weight that you want, or the lifestyle that you want to as well? And that's a serious question that the individual needs to find themselves.
Yeah, and I think the more that our patients lose weight, the more hormone and the more hunger that they're getting. And this is chronic health disease management. That's what we're here for. If we're putting you on cardiac medications for your heart and you stop it, what do you think is going to happen?
Yeah.
Probably going to have a little bit of heart issues again. Now, we really hope that, with the microdosing and listening to your body and your needs with the medications, that we can adjust some of your lifestyle management as well. And, when we saw Ozempic a year or so ago going out and, blasting all over social media and at the wards and everything, good news, lovely. But I really did enjoy, honestly, the negative side effect, the negative feedback that we're getting on social media too, talking about the weight regain and some of these complications, because not everyone should go on these medications either.
And not everybody wants to, right? I mean, we can do
Correct.
without, and that's what the way we used to do it too as well. I say about a third of our patients, maybe a quarter, don't use medication, and they can be successful in weight loss. But having said that, though, there are a few things that maximize weight loss. And let's say if your individual said, I need to lose as much weight as I can, well, it's going to be, medication, the pharmacotherapy, anti-obesity medications, with a intensive life intervention program in a medical professional clinic setting. And studies have shown this, that when these three combined, they give you maximum weight loss. That's a medical. And there's another component we didn't talk about, Sam. It's also the surgical component, which we do work with bariatric surgeons. There's certain people who just will fare better, with surgery, who have a very, very significant amount of weight loss. They should have bariatric surgery, gastric bypass, and so that's another thing we didn't talk about. But having said that, that's something we can talk about a little bit down the road. And so we're seeing now a marriage, or a collaboration between the surgical and the medical for maintenance of weight loss and maximum weight loss down the road too as well.
And just want to put it out there for all those who are taking anti-obesity medications, and aren't telling anybody, and that's fine. You do not need to tell anybody, but a lot of it comes around shame. And I just want to let you know, if you need medications, you haven't failed at all. itself. So I don't want you being ashamed that it's here. It is a medical management. It is making life easier for you guys as need be, cutting down your hunger, cutting down your cravings, making you in charge. The main thing is don't let the medication take charge of you. You know, when we take a few clicks in, you need to click in too. It's really important that we don't allow the medications just to cut back the amount of food that we're eating. So now we're eating less pizza. You know, we're not training the brain in the appropriate way, because when we stop, hey, you're still programmed for the pizza, and we'll end up having more and more and going. So needing medications is not a failure. It is a success for most individuals as they go. It is real weight loss too. It's not the fake cheating weight loss process as we go, but speak to your medical professionals. I think it's very important that if you are struggling and you want this and you need it for your health, you need it for your mental health itself as well, physical and brain, go and chat. Your physicians itself, they'll have some education on obesity management, but we're always here. A lot of the folks, I think it's about a half and half mix today, Dr. Lee, from outside our community and inside our community base. But you know where we guys are, and we've got more webinars coming up in this next month. Sorry, I had to write the date down because I was laughing with Dr. Lee for next month. I kept on getting it wrong. June 25th, okay? June 25th is our next Q&A period. Just listening about the things that we're seeing here today, whether you're outside or inside our clinic, let us know what you want to hear. You know, these are for you so you can get the right information and inject in there and get the help that you need. So I'm really looking forward to next month. Hopefully it stops raining too. I don't know if it's raining where you guys are, but we will see you again in June. Hope you've had a great May. Only a few more days left, and we'll see you guys soon. You can visit us at howclinics.com, and we'll see you there. Thank you, Dr. Lee, so much for chatting a little bit further so the patients can hear from you and see you, and we'll chat soon.
Thank you, everyone.